When polling firm Gallup asked Czechs whether they would get vaccinated against COVID-19, 53% said no. In Senegal, 55% said no. And in Jordan, 62%. In most of the countries Gallup surveyed, the proportion of people who said they would be vaccinated was below 70%. That's the lowest percentage of the population that scientists think needs to have immunity in order to stop the virus from spreading. It's a state called herd immunity, where the virus has a hard time finding new people to infect. Vaccination is the safest way to get there. Where vaccine hesitancy is highest, it may be about more than just the COVID-19 vaccine itself.
I think the number one thing we have seen from our work is essentially trust in government. That seems to be a strong predictor with regards to intention to get a vaccine.
Take countries such as Ukraine, Gabon, and Lebanon. In a 2018 Wellcome survey, most people there said they did not trust their government. Those countries also have majorities who said they will not take the COVID-19 vaccine. In all, Gallup found 20 countries where more than half the population said they won't take the vaccine. 10 of them are in Eastern Europe. That partly reflects people's attitudes there towards vaccines in general. In that 2018 Wellcome survey, only half of Eastern Europeans considered vaccines safe. That's the lowest rate in the world. These high rates of hesitancy are a warning for health officials, but they do change. When Gallup polled Americans last September, 50% said they would not get vaccinated, but that number fell to 26% by March.
It's a small proportion of the population here in the United States that is fundamentally and philosophically opposed to vaccines. That's a very small proportion. We then have a good chunk of the population that's pro-vax, but the majority of people in the United States are what we would call this movable middle, i.e. they're ambivalent, and they just need a nudge in the right direction.
One of the biggest nudges is seeing other people get vaccinated. Take this Kaiser Family Foundation poll. In December, when COVID-19 vaccines first arrived, more people said they would wait and see than those who said they would get the shot as soon as possible. From December to April, as more people got vaccinated, the wait and see group shrank from 39% to 15%. But getting hardcore skeptics on board is not easy. It has to be done on a local level, Lemaye said, sometimes person to person.
It has to be from individuals that people trust. This has to be community-based leaders, for example. Religious leaders are a key part of this solution. Other community influencers at the community level are really, really important here. It is a lot of hard work. It's not something that's going to be done very quickly and very easily.